Banner Health North Colorado, a leading and large nonprofit healthcare system, implements the Zero Suicide Framework and has earned Platinum H.O.P.E certification. In other words, Banner Health North Colorado cares deeply about suicide prevention for their patients as well as the well-being of their workforce. This is their story. Recent research shows that healthcare workers face high and rising levels of burnout, impacting patient care. Additionally, 40% of physicians are either afraid or know colleagues who are afraid to seek mental health care due to licensure, credentialing, or insurance application questions. This combination of work-related stress and barriers to care is associated with increased suicide risk for physicians, nurses, healthcare support workers, and health technicians.
Challenges in our industry now are more complicated than I've ever seen in my career, with ongoing workforce challenges, financial pressures, increasing regulatory burdens, heightened acuity, patients presenting with substantial substance abuse issues, as well as an increased prevalence of violence towards healthcare workers. Unfortunately for many, the amount of resiliency anyone has left in many cases is still very thin. No matter what your role is, it's harder than it used to be, and when combined with our personal lives, it's a heavy load.
If you're in doing zero suicide work, here's something to think about. We've been really focused on our patients and making sure that we're saving lives and doing all that really good work within zero suicide. When you look at the H.O.P.E certification, we start to look inward and really supporting each other.
The Zero Suicide Framework is an aspirational initiative aimed at preventing the suicide deaths of patients in healthcare systems. It emphasizes a system-wide commitment to safer suicide care through comprehensive approaches, extensive resources, and community support. By contrast, the H.O.P.E certification is focused on suicide prevention and mental health promotion for the healthcare workforce, with comprehensive strategies for cultural change and worker recovery. During the year of H.O.P.E certification implementation, Banner conducted a needs and strengths assessment and other culture change initiatives, bolstered their peer support resources, and prepared for worker mental health emergencies.
Because people recognize when one of their team members is struggling or maybe in a crisis, and they know now to intervene and seek out help. We have team members who volunteered to be what we call our H.O.P.E champions, and they are helping advocate and increase awareness, and additionally, some of them have volunteered to share their own personal journey with their mental health, and we actually send those stories out in an email to all of Banner Health team members in Northern Colorado. That impact has been incredibly positive and encouraging for our team members, both the H.O.P.E champions who are sharing their stories and the team members who are reading about them and encouraged by them.